survive with one lungs, yet damage to a small area of the lung can become life-threatening. So this is a question I expect you to think and answer this question and drop it in the comment section below. So Ari, we're going to start with the anatomy of the lungs. So we're going to make you understand the basic and the concepts of structures and organs that are found in the body. So at the end of this lecture, students should be able to know the answer of this question. Not only that, you're going to be able to define lungs, describe the external features of the lung, explain surfaces, borders and lobes of the lung, describe bronchopulmonary segments of the lung, explain hilum and roots of the lungs, explain and describe the blood supply, nerve supply and lymphatic drainage, which is the lympho-neurovascular structures of the lung, explain pleura and pleural cavity, relate anatomy of the lungs to clinical condition, learn how to write a full-mark MBBS anatomy answer on lungs. So I'm going to teach you all these things, so make sure you just take a cup of coffee and relax. So let's dive in straight to the point. So this is how we're going to write on the anatomy of the lungs. So first, I'm going to write the definition. After writing the definition or definition stroke introduction, you go over to the location and extent, go over to the external features, surface and borders, lobes and features. Then after this, and these are all the structures and microscopic of anatomy, you now move over to the functions and clinical aspects. So before you move over to the clinical aspects, you start with the hilum and roots, the blood supply, the nerve supply, the lymphatic drainage. Microscopic anatomy is also another aspect of studying anatomy using microscope. So I'm going to treat this as a separate topic in my next lecture. So then we now move on to applied anatomy. So let's start. What's the definition and introduction of anatomy? So first, what is the lungs? The lungs is the primary paired organs of respiratory system. I want you to take note of something. You said it is the primary. It is primary. Means, so when you're talking about the main organ of respiratory system, you know there are so many things that consist the respiratory system. So when you're talking about what is the main thing that is composed in the respiratory system, is the what? Is the lungs. It is paired organ. The word paired means two. They are not one. They are two paired organ of the respiratory system. So their primary function is gas exchange. So what is lung doing? Lungs is where gas exchange occurs. Which particular area of the lungs? The alveoli. This is where oxygen from the atmosphere diffuse into the blood and carbon dioxide diffuse out of the blood into the atmosphere. So let's talk about the location of the lungs. The lung is situated within the thoracic cavity on either side of the central mediastinum. Now, some people will now start asking, what is mediastinum? And mediastinum is just a space which is bounded anteriorly by the sternum and laterally by the lungs and posteriorly by the thoracic vertebrae. So the mediastinum just contains the heart. So it's a space that contains the heart that is bounded laterally by the lungs. So this is where the lungs are located, within the thoracic cavity on either side of the central mediastinum. So this is the region of the mediastinum, and the lungs is lateral to this mediastinum. They are lateral to the mediastinum. So this is where the lungs is located in the what? In the thoracic cavity. So what is the anatomical extent? Apex. The apex. So when we talk about the apex of the lung, look at the apex of the lung. This is what you mean by the apex of the lungs. So it extends into the roots of the neck. So the apex extends. We are talking about the anatomical extension. So the apex extends into the roots of the neck, reaching slightly above the level of the sternal end of the first rib. So the apex of the lung is 2 to 3 centimeters above the clavicle and the first rib. So after the clavicle, so when you measure 2 to 3 centimeters, you now see the apex of the lung, which move in and out during respiration. So the base is broad, concave. Now, I want to explain something to you. When we say something is concave, now let's just imagine this diagram now, this C-shaped structure. So if I say something is concave, meaning that I'm viewing it from this dimension. So concave, I'm viewing it from this dimension. If I say something is convex, it means I'm viewing it from this direction. Concave from this direction, convex from this direction. So don't confuse that. And from now, you now know the difference between concave and convex. Now, when we said the base of the lungs is concave, so if you think concave, as I said earlier, is in this dimension, you see it? It is a concave shape at the base, concave, which rests on the convex diaphragm. Remember, concave is from this dimension and convex is from this dimension. So when we say it rests on the convex diaphragm, now take a look at the diaphragm. And when I view it from this direction, when I say it is what? Convex. The concave of the lungs rests on the convex surface of the diaphragm. Or you can just say the base of the lung is broad and it rests on the surface of the diaphragm. So it's all accepted. Now let's talk about the external features of the lung. So when we talk about the external features of the lung, the base, the apex, the borders, and the surfaces are involved. So let's start with the borders. First, there are 3 borders that are actually considered when we are talking about the lungs, which are the anterior, the posterior, and the inferior borders. So the anterior border is thin, sharp edge where costal and medial surface meets. Now, just take a look at the anterior border. So this is the anterior border. This region here is the anterior border. This region here is the anterior border of the lungs. So they said is where the mediastinal surface and the costal surface meets. Okay. And the mediastinal surface is this region, the surface facing the heart. The surface of the lungs facing the heart is called the mediastinal surface, and the costal surface is the surface facing the thoracic cage, which is the ribs and the sternum. So the mediastinal surface and the costal surface meet at a point. That point where they meet, or that edge where they meet, is called the anterior border of the lungs. So the posterior border is broad, rounded, but it is a broad, rounded border resting beside the vertebral column. So this posterior border is resting on the vertebral column. You know, we have 12 thoracic vertebrae. So this 12 thoracic vertebra, the posterior border of the lungs is resting in the vertebral column, which is the thorax. And the inferior edge, or the inferior border, is a sharp edge which rests on the diaphragmatic base, or the diaphragmatic surface. So look at the inferior border. This is the inferior border. The inferior border rests on the what? On the diaphragm. So as I said, we have 3 surfaces. We have the costal surface, the mediastinal surface, and the base, or the diaphragmatic surface. So the costal surface is convex, extensive outer surface pressing against the ribs and the intercostal surface. So just have it in mind that the costal surface is the surface which is facing the sternum and the ribs. That is just the costal surface. The surface of the lungs, which is this anterior surface, you can see as the costal surface, facing the sternum and the ribs, is what's called the costal surface. While the mediastinal surface is the surface facing the heart, because the mediastinal surface contains the heart. It's like a space which contains the heart. So the part of the lung, or the surfaces of the lung facing the heart, is called the mediastinal surface, and it makes a cardiac impression on the left side of the on the both on the left side and the right side of the lungs. And remember, the left side of the lungs have cardiac notch. We're going to describe that when we are talking about the differences between the right and the left lungs. So the diaphragmatic surface, we always know, is broad, concave, inferior surface resting directly on the diaphragm. Just have it in mind that the diaphragmatic surface is the surface of the lungs resting on the diaphragm. And we have the right and the left lungs. So here, or this particular section, we're going to like describe the difference between the right and the left lungs. Now, let's start with the feature. What are features of lungs? So features of lungs are lines, grooves. Features of lungs are grooves that are present, or grooves that divides the lungs into lobes. So when you hear the word features, features just mean grooves. Grooves are depressions that divides the lung into lobes. So we have features in the right lungs and we have features in the left lung. Now, for the right lung, we have two features, which are the horizontal features and the oblique features. The horizontal feature and the oblique feature. Now, in the left lung, we only have one feature, which is the oblique feature. And these features are growth that divides the lung into lobes. Therefore, we now have lobes of the right and the left lungs. So the lobes of the right lungs are three, which are the superior, the inferior, and the middle lobes. Now take a look at the superior or the upper lobe, the lower lobe, and the middle lobe. Now these are features. These features divides the lung into lobes. So these lobes for the right, there are three, which are the superior or the upper lobe, the middle lobe, and the inferior lobe. And for the left, it is only one features, and this feature now divide the left lung into superior lobe or upper lobe and lower lobe or inferior lobe. Just have it in mind that features divides the lungs into lobes. So for the weight, the right lungs is more heavier than the left lung. Just have that in mind. It varies in individuals. So just must have it in mind that the right one is more heavier than the left lungs. So let's talk about the dimensions. So when we talk about the dimensions of the lungs, we are trying to explain the size and the measurements of the lungs. So the right lungs is shorter and wider. Now, if you take a good observation of the lungs, you see that this right one is shorter and it is what? Wider. It is wider when you view a lungs in very, very standard anatomical textbook, such as Gray's anatomy textbook. You observe that the lungs is shorter, the right one is shorter and heavier, wider, while the left one is just longer and narrower. Narrow means thin, it is narrower, while the left lung is longer than the right lungs. So we have the cardiac notch. The cardiac notch is absent in right lungs but present in left lungs. So what is cardiac notch? Cardiac notch are deep indentation on the anterior border of the lungs. So what are indentation on the anterior border of the lung? We're talking about impressions. Now take a look at the cardiac notch. We said it is absent for the right lung. So the cardiac notch is not present in the right lungs, but it is present in the left lung. Look at the cardiac notch. It is an indentation in the anterior border. Indentation we're talking about there is the impression. It's the heart makes an impression on the left side of the heart. So there is an impression. That impression on the anterior border of The left lung is called the cardiac notch. Let's talk about the lingula. The lingula is absent in right lungs, but is present in what? Left lung. So the lingula is a tongue-like projection from the superior lobe or the upper lobe. Now, this is not where the lingula is. Look at where the lingula is. It's that it is from the what? Superior lobe or the upper lobe, and this is the lingula. It's like a tongue-like projection, as you can see there, and this lingula is absent in the right lungs but present in the what? In the left lung. Don't forget that lingula is present in the left lung, and it is like a tongue-like projection from the superior lobe, and it is at this junction. So we have the mediastinal impression. So when we're talking about the mediastinal impression, we're talking about structures located in the mediastinum that makes an impression. What are the structures that are found in the lungs? The structures that are related to the lungs. We're talking about impressions. They leave a mark. They leave a mark in the lungs. That's impressions. That's what we're talking about. The mediastinal impressions, structures that are found in the mediastinum. We have the azygous vein, we have the superior vena cava, and we have the esophagus for the right lungs. And for the left lungs, we have the aortic arch and the descending aorta. So these are just the few things you should just know about the lungs. So let's talk about the hilum and the roots of the lungs. So when you hear the word hilum, what comes into your mind? So hilum is where lympho-neurovascular structures enter and exist in the lungs. So hilum is just like a doorway in the mediastinal surface. Mediastinal surface is the surface of the lung facing the heart. So the surface of the lungs facing the heart has a hilum. That hilum is just like a doorway where lympho-neurovascular structure enter and exist in the heart. You hear the word lympho-neurovascular structures, we are just talking about the lymphatics, which is lympho, neuro, the nerve, vascular, blood supply, and just structures. So this is where blood supply, lymphatics, nerves enters and leave the lungs, and also airway. These are like the hilum is just provide. It's just like a doorway where structures enters and leave the lungs. Just have that is just the main thing you have to just know about the hilum. So we have the right lung and the left lung, and this right lung, the artery is anterior to the bronchus. Now look at the pulmonary artery. This is the pulmonary artery, and look at the bronchus. So for the right lungs, and this is the right lungs. So for the right lungs, the pulmonary artery is anterior. Look at it. It is anterior to the bronchus. While for the left lung, it is superior to the bronchus. Now look at the bronchus and look at the pulmonary artery. The pulmonary artery is superior to the bronchus for the left lung, and is anterior to the bronchus for the right lungs. Don't forget that. Regardless of the side, the two pulmonary veins are always positioned in anterior inferiorly. That means in front and below. So the two pulmonary veins is always anterior in front of the lungs and inferior. Now look at the two pulmonary veins. Look at this. Both of them are always anterior to the bronchus and always inferior to the what? To the bronchus. That is all we have about the hilum and roots of the lungs. Here is a question I want to ask you. Why do the right lungs aspirate than the what? The left lung? Let's talk about the bronchial tree, which is the airway architecture. So what's the loss? The bronchial tree is just trying to explain how these airway structures subdivide or branches into the lungs. So you know we have airway structures. So what are these airway structures? These airway structures are structures which are responsible for taking in oxygen, carbon dioxide in and out of the lungs, and they are lined by epithelial cells, and they also moisten. They moisten, the air and bronchi tree perform so many functions. But when you hear the word bronchi tree in God's anatomy, it's just trying to explain how these airway structures branches into the lungs. So the first one is the trachea, and look at the trachea. This long pipe here, which are made up of cartilage, trachea cartilage, ring cartilaginous structures are called the trachea. So this trachea branches into left and right main bronchi, or the bronchus. They branch into left and right bronchi. So the junction or the ring cartilage where this trachea branch into left and right bronchi is called the carina. So there is a ring structure, cartilaginous ring structure, which we call the carina, where this trachea reaches and branches into left and right bronchi. And this region is where, when the epiglottis fails to close during swallowing and food particles are found in this junction or in this region, guess what? The patient or the subject infected starts coughing. So that moment when you are coughing because you were